Welcome back. You are listening to the Maryam Mkwanda show on Salam Media. It is Health Tuesdays, and today's topic of discussion is hepatitis. Joining me to tell us more about it is Dr. Bilal Bobat. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Bilal, shukran for joining me.
Walaikum salam. Thank you so much for inviting me.
Alhamdulillah. So, Dr. Bilal, we hear a lot about hepatitis, but many of us have no idea what it is. What exactly is hepatitis?
So, the exact term hepatitis means an inflammation of the liver. Any term with that suffix itis is inflammation of, and hepa is of the liver. So you can have hepatitis from a variety of different conditions. One of the most common of which is inflammation coming through from viruses, hepatitis, viral hepatitis A, B, and C being the most common in South Africa. But you can also get hepatitis from other causes, including from various drugs. Certain drugs you can get a bad reaction from, and you can get a drug-induced hepatitis or drug-induced liver injury from. You can get certain types of allergic reactions from drugs. Naturally, most people know of hepatitis coming from alcohol and alcoholic associated liver injury, but there's also something called non-alcoholic steatohepatitis, where you get a lot of fat in the liver, and that causes liver injury as well. So hepatitis is any form of liver inflammation.
Now you've mentioned hepatitis A, B, C, and D. Just quickly take us through them and how are they different from one another?
Okay, so viral hepatitis A is generally found in poorer socioeconomic circumstances. It is a disease that is spread often through poor sanitation and is commonly found through the fecal-oral spread. That means that, from soiled food, obviously not where it is obviously messed food, but microscopic spread on especially fresh fruit and vegetable. This is then ingested, and the virus is then consumed with that fruit and veg. You often have outbreaks of viral hepatitis A, and this can occur not just in necessarily poor countries, but also in rich countries. In fact, in California, at the moment, there's a hepatitis A outbreak amongst the homeless in that. I think it's San Diego at the moment. That's affecting the homeless there because of their poor socioeconomic circumstances. Viral hepatitis A then can present with fulminant liver failure. This means that it can affect the liver so badly that the entire liver can be can stop functioning, and you go into liver failure. This is where the liver stops working, and your blood is effectively poisoned. Certain clotting factors aren't produced, and poisons from your gut are no longer cleared. And therefore go up to the brain, resulting in a coma situation that is life-threatening. All right. At our center, at the Wits Donald Gordon Medical Center, we do transplant patients for this condition. It's often older children and adults that this happens to. because in younger kids, it's often a relatively mild infection. They often present more with a diarrheal illness, nausea and vomiting, and less liver-related illness. You often don't really see much of the yellowness in the eyes and so on, and you see more of the diarrhea and so on. Viral hepatitis B then is a major problem in South Africa. Viral hepatitis B is what we call endemic in certain communities. It's passed quite commonly between mother and child. Despite there being a widely accessible vaccine that is in the government's vaccine protocol. Unfortunately, it's a cold chain vaccine, so whether the cold chain is effective in getting it to the kids is questionable, and whether it's given to them in time is problematic as well. There's also certain things that need to be, the mum needs to be treated for viral hepatitis B before giving birth to lower the viral load so that it's not transmitted to the child before delivery, to break that chain of transmission. The reason for this is that if the child acquires viral hepatitis B in early childhood, especially in the neonate period, the chance of chronic infection is 90%. Chronic infection means that they often don't demonstrate any signs of acute infection, but carry this virus through into adulthood when the chances of a low-grade grumbling infection is high, and there's a good chance of cirrhosis occurring and liver cancer happening when this individual comes into early adulthood, and by this I mean into their 30s. Common areas in South Africa are the Northwest Province, Limpopo, and into Mpumalanga, and then patches of the Eastern Cape, where these vaccines have not really been taken up in good penetration. The other source of viral hepatitis B transmission is then in later adulthood, where it is then either sexually transmitted or via needle injection. It's basically transmitted in similar ways as HIV. It is 100 times more transmissible than HIV. So there's that aspect as well. When you pick it up as an adult, you're far more aware that you've picked it up because you've got a far more robust immune system that mounts a vigorous immune response against the hepatitis B. You know that you've got hepatitis B because you present with the jaundice, feeling sick. There's the nausea, what we call malaise, right upper quadrant. That means that in the right upper part of the abdomen, you can feel some tenderness or pain. And you feel quite fatigued and so on, and in terms of the general features of the condition. But most adults tend to recover from this. About 1% of adults will result in fulminant liver failure, where they, if they don't get a transplant, similarly will potentially die from this. Viral hepatitis C then is a bit harder to transmit. It's transmitted through needle spread more commonly. So individuals who inject drugs, that's the main method of transmission at the moment, because blood transfusion programs have recognized this as a problem and have started screening for this in far better methods. This wasn't the case up until the mid-90s. This virus was only identified in 1992. So, I don't want, my initial statement to create any stigma for someone with viral hepatitis C because this wasn't a known virus up until then. The other place that it can be spread is, for instance, in dialysis units. So anywhere where there's an actual injection happening. In Egypt, for instance, unsafe medical practices led to widespread medical spread of viral hepatitis C. So hepatitis C is a bit harder to spread. You often don't know about the spread of hepatitis C, and it's what we call a slow burner of a virus. You don't necessarily present acutely and very sick initially, but you present with a slow grumble, and you land up eventually with cirrhosis. You also land up with a variety of other manifestations, for instance, funny skin rashes, thyroid disease, worsening diabetic function. They often have various psychiatric problems, depression, general poor quality of life, kidney problems, vasculitis, other autoimmune problems, sometimes even some types of cancer that are all associated with the immune dysregulation associated with the virus. The good news is that as of 2012 or so, the cure for hepatitis C was found. And we now have very effective cures for viral hepatitis C that are now becoming increasingly available at a cost that is becoming less and less. We can now cure hepatitis C for approximately 10,000 Rand over a 3-month period. Which is becoming more accessible, considering this is a lifelong illness. There are other viruses that can affect the liver. You mentioned hepatitis D, for instance. Hepatitis D often will need hepatitis B in order to function. So it's kind of like hepatitis B's sidekick, and when it occurs, it just basically makes things that much worse and accelerates everything. There's also a viral hepatitis E, which you can pick up from venison or hunting wild animals, and then pork, but then also from camel meat in the Middle East, which, if you're immune suppressed, can be a problem. But these are some of the rarer causes of viral hepatitis in South Africa. Just in terms of a more common condition is viral hepatitis of viral hepatitis is Epstein-Barr virus. Or infectious mononucleosis. That can cause a mild hepatitis, often with enlarged lymph nodes and enlarged spleen. And that can also leave you with jaundice and feeling unwell for a period of time.
All right. So, doctor, what treatment is available for hepatitis, and is it does one need to go for treatment all the time, or can you just get a what is this, sort of like a once-off treatment and you're done?
So viral hepatitis A, there are effective vaccines for, which I would recommend people take, especially if they're traveling. There is no effective treatment for viral hepatitis A once you acquire it. And management is supportive. That means that we try and support you with your fluid intake if you're dehydrated from the diarrhea and so on. Viral hepatitis B, again, there's no effective treatment to cure hepatitis B. We do have treatments for patients with chronic hepatitis B, where patients, where we can control the virus in terms of the replication, but we can't cure the virus. Now, controlling the replication is important because then we can stop complications from happening down the line. We decrease the chance of cancer developing, and we decrease your chance of cirrhosis. In fact, there are studies showing that even if you have cirrhosis, early stage cirrhosis, we can reverse those changes and bring your liver back to a normal state of functioning. We also have had success where individuals who have already had a state of loss of function of their liver, we can bring back some function by reducing the amount of inflammation in the liver, by treating them and suppressing the viral replication, by reducing the amount of inflammation in the liver with these drugs that are very effective at stopping the inflammation. This drug is a antiretroviral that is also used for HIV, tenofovir, and is quite common in South Africa and is very cheap. So that has been a massive bonus for us in South Africa, where we've got a hepatitis B problem. So yes, there is effective treatment then for the control, but not cure of hepatitis B. I've already mentioned the cure for hepatitis C, and there are multiple drugs that are available for the cure of hepatitis C. Hepatitis E, unfortunately, there isn't really much in terms of cure there. We're still working on that, and there are some promising suggestions in that line.
Now, what happens if hepatitis goes untreated? Can it become something worse?
So, as I talked about in terms of both hepatitis B and C, if left unmanaged, it's basically a slow smoldering fire that will eventually result in chronic damage to your liver that results in a condition called cirrhosis. Cirrhosis is the hardening of your liver, where it heals by forming scar tissue. Your liver it acts as a sponge and as a filter, all right, where blood washes through the liver and is filtered. And when your liver can't filter the blood, it can't serve its function. And unfiltered blood is therefore spills around the liver, thus going into the rest of the circulation, where it can result in poisoning of the rest of the body. This then results in problems that can lead to complications, such as a condition called hepatic encephalopathy, where certain toxins go to the brain, leading to confused thought. You also get something called ascites. This is where blood can't flow through the liver because of the hardening, resulting in abnormal fluid dynamics in the body, resulting in accumulation of fluid in the abdominal cavity. This can then, with those altered fluid dynamics, also then affect the kidneys, the heart, and so on. So by ignoring and not treating liver inflammation, yes, you can lead to some seriously dire consequences.
Okay, so what can we do at home to avoid getting the most common hepatitis?
Okay, so number one, both viral hepatitis A and B, there are effective vaccines available. So,
right. I think the network is getting the better of us right now. Doctor, can you hear me?
Yeah, I can hear you well. I can hear you. Maryam?
Of your dreams and surround yourself with her spectacular beauty. Relax beneath his serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
It's time to act now. COVID-19 is a global pandemic and we need your help to flatten the curve. Islamic Relief is reaching out to the most vulnerable of our community in South Africa, Yemen and Gaza. 400 Rand can provide a family with a food pack in South Africa and 500 Rand a hygiene pack in Syria, Yemen and Gaza. With your help, we can save lives across the world. Donate now. Go to www.islamic-relief.org.za.
This is Salam Media, and you are tuned into the Maryam Mkwanda Show.
Welcome back. You're listening to the Maryam Mkwanda Show on Salam Media, and I apologize for that. My network decided to kick me out of the conversation. But Dr. Bilal, just quickly wrap up for us. Before I got disconnected, I asked about at home, what can we do to avoid getting hepatitis A, B, or C?
Right. I was saying there are effective vaccines against both viral hepatitis A and B. Most children in South Africa are now vaccinated against viral hepatitis B, and you can opt to take a vaccine for viral hepatitis A as well, but this is done through private chemists or through your private general practitioner. There is no vaccine against viral hepatitis C yet. There are, in terms of viral hepatitis C, like I said, there are certain high risk behaviors which one would have to take in order to acquire hepatitis C. And it's often, like I said, intravenous drug users. It's almost like inoculation type matters that would be associated with that high risk sexual practices that would be associated with the contraction of hepatitis C.
All right. Shukran so much for your time, Dr. Bilal. As Razia said, it was very informative indeed. I know I learned a lot more about hepatitis. I just, after giving birth, I know I had to take my baby for injections, and one of them was hepatitis, and I had no idea, like, what is hepatitis? It's there, but she has to go for the injections. But now I have an idea. So shukran so much, and have a lovely day.
You too. Shukran for the opportunity.
Assalamu alaikum. Right, that was Dr. Bilal Bobat talking to us about hepatitis. If you also just learned about hepatitis, well, then we learn something new every day, which now brings us to the end of the show for today. Do join me again tomorrow from 11 to 1 p.m. right here on Salam Media. This is the Maryam Mkwanda Show. Keep the comments coming. Leave your suggestions and questions as well. And you can also send them to us on WhatsApp. The number is 061-766-0355. From myself, Maryam Mkwanda, and the Salam Media team, Assalamu alaikum wa rahmatullahi wa barakatuh.